eliminating cost sharing. Americans consume more goods and services today than ever before. Because of this, Americans like to think of ourselves as savvy and smart consumers. It can be assumed that usually the more money spent on a good or a service guarantees that the service will be of higher quality. While this is true for most products, the largest and most expensive American expenditure is quite different. According to the textbook Healthcare Delivery in the United States, healthcare expenditures account for 18% of our gross domestic product. That means that 1/5 of the American economy is supported by healthcare expenditure. Additionally, while the United States has the most expensive healthcare system in the world, it also has worse health outcomes than any other developed nations. In fact, the United States has the shortest life expectancy and the highest rates of pregnancy-related mortality, according to Peterson Kaiser Health Symptom Tracker. This leaves many Americans wondering why we're paying so much more for worse health outcomes. The real question to ask is, why is healthcare so expensive in the first place? The reason healthcare is so expensive is due to a variety of factors, but the most important is that the United States has a healthcare system that focuses on reactive care and does not do enough to address out-of-pocket costs for the patient. According to a study by Dr. Jennifer M. Tabor, 24.1% of survey participants did not seek medical care due to the high cost of medical services, including patients that thought their health care or their medical care would be absolutely necessary. Because of this, many patients put off care until it's extremely necessary, driving up healthcare costs for everyone. Additionally, high costs of medicines to treat manageable diseases affect overall health outcomes. According to the National Library of Medicine, a study was done to analyze 160 articles that studied drug adherence and cost-sharing tactics. Analysis of these articles concluded that 85% of the articles reviewed showed that patients who were subject to increasing medicine costs were significantly less likely to adhere to their treatment plans. When the Affordable Care Act was enacted in 2010, one of the main focuses of the sweeping legislation was eliminating cost sharing for preventative healthcare visits. Cost sharing, or the balance of what is paid by the patient and what is paid by the insurance company, is a hindering factor for those who need treatment. Cost sharing practices currently affect vulnerable populations the most, according to Catherine Swartz, author of Cost Sharing: The Effects of Spending and Outcomes. The cost of cost sharing for patients of low socioeconomic status is too high to be regularly attainable. The Affordable Care Act mandated that prevention visits would be covered 100% by insurance companies. A solution that would enable more accessibility to healthcare would be to eliminate all cost sharing between insurance companies and patients altogether. This would mean all healthcare plans would have to cover 100% for all services rendered, including copayments and annual deductibles. If patients were assured that they would not be subject to large and costly out-of-pocket expenses, more patients would seek out services before the ailment has caused extreme detrimental and expensive health problems. Unfortunately, the only way to get health insurance companies to cover at 100% would be to establish legislation that forced them to do so. Because insurance companies are for-profit entities, they must do everything in their power to make money. Because of their fiduciary obligation to their stockholders to make as much money as possible, it is highly unlikely that insurance companies will cover at a higher percentage of fees without legislation. Legislation that mandates the elimination of cost sharing would not only increase accessibility to healthcare, but would also drive down costs due to more people seeing doctors before disease onset. This solution lowers costs, increases accessibility, and gives everyone a fair shot at living their American dream.